Hi, my name is Dr. Jared Keller and I'm an emergency physician. For the purposes of this video, I'm going to take off my mask so that the audio is a little bit better, but keep in mind during a pandemic, we should probably be wearing our masks. In today's video, we're going to talk about putting in ultrasound-guided peripheral IVs. Now, this is becoming a hot topic, especially because there are a lot of patients out there that really fall into the category of tough sticks or they're difficult to place an IV on. So during this video, we'll be talking about how to do that successfully. For further reading or further study, there's actually another video out there, EM in 5 by Dr. Seidel, which I encourage you all to take a look at. I'll see if I can't send out an attachment for you so you can find it a little bit easier. With my training at LA County Hospital, we had machines like this, and we had a lot of training on ultrasound. Ultimately, I placed many of these. I have a lot of experience and a lot of things that I can share with you that I think will help you be more successful in this process. Now, I can never remember that many things, so I try to keep things down to 5. Any more than 5, can't remember it. Any less than 5, it's probably too simple. But I've created a mnemonic for you to kind of help you go through this process successfully. Pulsed, so P-U-L-S-T, a little bit different. P, positioning, U, ultrasound knowledge, L, long angiocath, S, structure identification, and T, technique. In the following videos, we'll go through each of these individually so that you know exactly what you're doing before you do it. The first topic I want to go over is the P portion of pulse, which is positioning. There's a saying that's very important in emergency medicine, which is fortune favors the prepared. In this circumstance, the more time we spend preparing for doing this procedure, the less effort that will actually be needed to do it. So there's a few concepts that I want you to remember. First and foremost, when we're preparing to put in the ultrasound-guided IV, there's some people like to be sitting, some people like to be standing. In this case, I like to be standing. So what I'm going to do is I'm going to make use of the bed, and we're going to pump Chris up here all the way to the top. This is my guest Chris, who's going to be helping me today. But I'm going to pump Chris all the way up to the top so that I don't have to hunch over in order to put in this IV. All right. The next step is I want all of his blood circulation to be in the upper half of his body, which means that we're going to put him in Trendelenburg, meaning head down. So Chris, go down. That way we're draining all the blood out of his legs and into his upper body. You can even tilt the head of the bed up so they don't feel quite like they're gonna slip onto the floor. All right? The next step is I'm gonna hyperextend his arm. So keep in mind these angiocasts that we're gonna use are very long. Ultimately, having a bent arm is gonna make it a problem for putting that whole needle and that whole catheter into their arm. So it's super important that if I'm going to have him do this, I want his arm to be hyperextended. Very simply, just put something underneath their arm so it's nice and extended for you. I don't have a tourniquet on him, but while you're preparing, one of the things that you can do to help yourself is apply the tourniquet. I know that there's a stigma that we don't want the tourniquet applied for too long. Keep in mind, tourniquets can be applied up to a few hours without any deleterious effects in the future. So just a few extra moments here will actually help engorge the veins and make your target nice and big. We're looking for a basketball hoop, not a golf ball cup. All right. So we have him nice and extended. We have him in Trendelenburg, getting all of our blood flow up into the upper extremity. The next part of positioning here is where am I going to put the ultrasound? One of the things I've seen people do is put it on the opposite side of Chris over here so that as I'm putting in the ultrasound, I'm looking at the monitor as well. And that's great, except that if I have to adjust the monitor, I do have to reach across Chris, and it does become kind of awkward. This is a COVID patient. I don't want to put myself too close to their airway. So what I personally like to do is keep the ultrasound on my side. Yeah, it's not perfectly in line, but ultimately it is enough. And once I puncture the skin, I'm really not going to be looking at the patient too much anymore. It's mostly going to be on the monitor. The second letter in the mnemonic is U for ultrasound knowledge. So we have to learn how to actually operate this device. And unfortunately, there's so many different models. There's a lot of complexity to these things. So I'm going to try to keep it as simple as possible because frankly, I like simple. Let's keep things simple. To start, plug in your device. I can't tell you how often, I'm sure Chris can attest to this, where you're in the middle of putting in an ultrasound guided IV and the thing crashes on you. Plug it in. Make your life easy. So that'll be step one. Step two, turning it on. Sammy, why don't you come a little bit closer for me and I can show you. Up here in the upper right-hand corner of the device is this little button. That's our power button. You'll see that as soon as you press that, the machine starts to wake up a little bit and you have two monitors. Again, there are many different types of ultrasounds. This is our ultrasound. We'll talk about this one specifically. This one does have two monitors. This top monitor, don't need to touch it. This one down here is actually interactive. So as you can see, we've now got the machine nice and booted up, and I'll tilt the screens that way we can kind of see both in the same shot. So to begin, we need to select the right probe, right? So probes are these devices that are attached to the machine, and you can only have one selected at a time. The one that we want for this specific task is the linear probe. You'll know it because it's the skinny guy, and it actually does look like a line, whereas if you compare it to this one, this is the curvilinear, and this one over here is the phased array. Okay? You don't need to remember that. You just need to remember, use the skinny one. Use the one that looks like a line. It's called the linear probe. All right? To begin, what you're going to see is I'm going to put some ultrasound gel on the probe. This is just a conductive medium for the ultrasound waves. And you'll see that as soon as I did that, usually something's going to start to show up on the screen. All right? But now we got the probe set up. We've got gel on the probe. How do we make sure that the machine knows to be using that probe and not one of these other ones? If you look at this monitor, you'll see that there are a couple things that you can select. The third selection over is the select transducer. You're going to poke that one, and then you get all these different types. Phased array, curvilinear, this is the linear probe. Just select the Venus setting. Sometimes it'll automatically open up, sometimes you need to hit scan. So now we're into the actual scanning process of using the ultrasound. You can see that we're already seeing ultrasound waves up here conducting through the medium. And down here, we have a couple more things that we can adjust. These are pretty standard across all ultrasound machines. The word gain is going to become very important. Gain, even though it's kind of misleading, is basically talking about the brightness that comes from the ultrasound machine. So what you'll see this is your gain slider. And if you look on the top screen, and as I move this to the right, what you'll see is that the screen is actually going to start to get brighter. And as I move back to the left, it's going to get darker. For this procedure, we want as much light as possible. So gain, or this bottom slider, is just another way of looking at brightness. We want it as bright as possible. So that's along the x-axis, if you will, for this machine. The y-axis is measuring depth. So what you'll see is if I start to select a higher number, basically this is going to be a shallower depth. So we're looking less deep into the arm or whatever structure we're looking at. If I select a lower down mark on the y-axis, what you'll see is that we're actually extending deeper into the tissues. For this, if we're going to be looking in the arm, you really don't need much more than the first 3 or 4 on the y-axis. So we have that set up. The next thing I want you to know about is actually knowing on your ultrasound probe where the indicator is. So what you'll see is there are some notches on the side on this linear probe. This notch corresponds to this marker on the monitor. In different ultrasound machines, there's a very similar thing. Sometimes it's an orange dot, sometimes it's not a line, it's actually a dot. For our purposes, you got a line here, you got a mark there. Don't believe me, or you can't remember that? Just touch the corner, and what you'll see is that as I touch the left part of this device, you'll start to see some wiggling on the monitor in the same place. Lastly, as you're setting this up, so now you have your probe gelled, you have the correct probe selected, you have the gain all the way up, you have the depth correct. The last thing I want you to remember is M mode, M. So when you hit that button, what you'll see is that there is a line that shows up right in the middle of the screen. That's going to correspond to the exact middle of the probe, which actually has an arrow on it. So what you'll see is if I wiggle right there in the middle, you'll see that there's going to be some wiggling along that yellow line. That'll kind of give you an idea of where you are at any time during this procedure. The L impulse stands for long angiocath. Extra emphasis on the long part. There was a recent study in the Annals of Emergency Medicine by Ball et al. That basically looked at the comparison between short angiocasts and longer angiocasts. It actually showed that the survivability of the longer angiocasts was way better than it was for the shorter angiocasts. I could speculate for you. Basically, if you have more of the catheter in the lumen of the vessel, there's less shearing forces. To be honest, it's unclear, but it is pretty clear that they are better in terms of surviving longer in the patient. You have to keep in mind that a lot of these patients are what we call tough sticks. We really want to do this one time, and we only want to do it one time. The more times we have to go in the room, it slows down patient care. It takes away from other things that you could be doing. But it's super important that we understand how these things work. So Sammy, if you will come a little bit closer here for me, I'm going to actually put this in front of the sheet so hopefully you can see it a little bit better. But do not be intimidated by these devices. It still works the same way as another angiocath. So you have the needle aspect, so the sharp pointy end over here with the catheter that slides on over the top. But you have an added feature, which as I move this slider, you're going to notice that at the end over here, a little wire is going to pop out, and it's actually got a little curlicue at the end. The reason for that is you can't cause damage with that curlicue. Why is that important? Well, if any of you know what the Seldinger technique is or familiar with central lines and how you actually use a wire to hold positioning, what you can do is if you actually insert into the vessel and you're having trouble advancing the needle totally, what you can do is actually advance the wire, and the wire will act as the same placeholder as the needle does. And you'll see that I can actually slide the catheter over the top of the wire the same way. So the S in Pulse stands for structure identification. Basically, we need to know what we're looking for on this device. And now that we know how to use it, let's take the next step. So I'm going to go back through this portion of the ultrasound setup. Keep in mind we have Chris correctly positioned, right? So he's elevated, his head of the bed is down, he's got his arm hyperextended, and I have a tourniquet on him. He's ready to go. All right. So now going back to the ultrasound machine, we're going back to the transducer. So I want to get the linear transducer, or the linear probe. I'm going to select venous. We're going to start scanning. I'm also going to do the M mode. We're going to increase the gain. Remember, that's the X axis. We're going to go all the way to the end. You can already see it brightening. And we're going to go ahead and leave the depth where it is. So Sammy, if you wouldn't mind coming a little bit closer, and have you take a look at the actual monitor. So what we're going to do is I'm going to start pressing the probe against Chris here. And as you can see on the monitor, we're going to start to see some black structures on the monitor. Now those are our blood vessels. But how do I know? Well, ultimately, if you haven't used ultrasound very much, this can all look very intimidating. And I'm actually going to decrease the depth so we can even see them a little bit bigger. But how do I know? It all can look very intimidating. It all looks like a bunch of gray. Well, you don't have to know this function, but I'm going to turn on the color Doppler so that way you can see, and I can prove to you that ultimately this pulsating structure here is Chris, and he's got a very low resting heart rate. Look at that, cool as a cucumber. But that pulsing vessel right there is his artery. So the one right next to it is going to be our vein. That's actually our target. All right, well, how do I know? Because ultimately, if I'm not using color, they just look like a bunch of gray circles. Well, there's another thing that you need to know about, which is the compressibility of the blood vessel. So what you'll see is as I press down on Chris, you can see that the vessel itself starts to collapse, except for the artery. The artery is actually helping us out here because it's starting to pulsate. As I relax with the compression, the vein starts to open up again. One more time. If I press down just on the skin overlying where I'm looking, you can see the artery stays open, the vein collapses. Basically, it comes down to the amount of pressure that's in the artery and the level of musculature that's within it. So now we've correctly identified our structure. We are ready to begin. You can start your M mode and start targeting the correct vessel. So the T in Pulse comes down to technique, and this is arguably one of the most important parts. After you've spent all your time setting up the patient, setting up your machine, identifying your structure, now we actually have to do the deed. So I'm going to start with my linear probe, and I'm going to put it on the patient. And after I've identified the correct structure using compressibility of the vein, I can now get ready to actually make a puncture. Now, when you go to make a puncture, remember that the most painful part of putting in an IV is actually breaking the skin. So feel free to make a quick puncture and then find yourself afterwards. Remember that as long as you're keeping track of where the middle of the probe is and where that M mode line is, you're always going to be in the middle. All right, so you should be able to find yourself pretty quickly. With that being said, after you puncture the skin, I want you to remember the inchworm technique. So we aren't looking for flash. I know that used to be, and sometimes still is, the teaching for placing IVs. But in this case, what we're actually looking for is, I want to be in the vessel, I want to see it in the vessel, and then I want to convince myself using the ultrasound that I'm entirely in the vessel, and I'm going to put the entire needle into the vessel. If I can't put the entire needle into the vessel, then I'm going to use the wire to help guide myself. So to begin, I'm going to anchor my hand on Chris here. That means the palm or the side aspect of the hypothenar eminence of my pinky is going to be against him. And I'm going to be holding the probe like a pencil. And then I'm going to puncture the skin swiftly, and then I'm slowly going to inch. So I'm going to advance the probe and advance the needle. Advance the probe, advance the needle. Advance the probe, advance the needle. And what we're looking for on the monitor is, you will see that if this is our vein here, you will see the needle within the lumen of the vessel itself. You're going to advance it forward, and the needle will no longer be visible. Then you advance the needle until it is visible. Advance the probe, advance the needle. Advance the probe, advance the needle. And you're going to do that essentially until the needle is completely hubbed into the patient. Then you retract the needle and you do your normal process for connecting your IV tubing. All right, guys, moment of truth here. So I have Chris in the perfect position. He is not happy about doing this procedure. I'm going to be placing a peripheral guided, ultrasound guided IV on him. So a couple parts that I want you to see. Number one, again, remember positioning. I have the M mode set up. I have the ultrasound ready to go. I am using the linear probe. I've already found my specific target, which you'll see on the screen is that small circle up there. And I've actually have it on the shallowest setting, so I'm using the most real estate possible, just dedicated towards seeing the vessel, seeing where I'm maybe putting the IV. All right, so I don't mean to torture Chris here, but we'll just do this really quickly. I do want you to see the inching technique, and then I'm actually going to show you how the wire works. And once we're all done, okay? So to begin, I'm using, again, that's right in the middle is where the M mode marker is. You can see it's directly lined up over the top of the IV. I'm going to make a quick poke. All right. And what you'll see, if I catch it just right, you can see on the monitor, there is a little white speck in the middle of my vein. All right. And I can prove it to you. So as I start to wiggle a little bit, it starts to wiggle a little bit. Okay. So the inchworm technique is I'm going to, you can see the needle in the middle of the screen right now, or in the middle of the lumen of the vessel. I'm going to advance into the vessel a little bit where it looks black, and then I'm going to advance the needle until I can see it again. Advance the ultrasound probe until I can't see it, and then I'm going to advance the needle. Advance the ultrasound probe, advance the needle. All right? So as I'm doing this, one of the things that we can do is I can use the wire, and you can see how effective that is. So I'm going to start pressing the slider, so it's sliding into the blood vessel. All right, Chris had no pain with that, correct?
Correct.
All right, so we know that the wire is in place, and now I can advance the catheter. I know it's in the correct place, and I can get rid of my needle. So we are all set, and we can attach our tubing. All right, and that's how you place a peripheral ultrasound guided IV.